we have Tipu Islam. He's a research associate with the Canadian Coalition for Green Healthcare, and he'll talk about single-use plastic.
Good afternoon. Can you hear me? My name is Tipu, and I'm a research associate at the Canadian Coalition for Green Healthcare. We are a national charity dedicated to advancing environmental sustainability in the healthcare sector. I'm sure you've heard a lot about us already in the morning in our introductory session. Part of the way we accomplish the work that we do is through our many branches, many of which outgrow this slide. The branch that I'm a part of is called Circular Clinical Care, Single-Use Plastics Reduction. I work alongside our project manager, Sandra, and our project advisor, Linda, to find ways to reduce single-use plastics within healthcare systems. We work on this national 3-year project funded by Environment and Climate Change Canada, who at the beginning of Climate Week made an announcement regarding $1.8 million in additional funding for advancing circular plastics economy in Canada. Our partner organizations include Hamilton Health Sciences, McMaster University's Department of Postgraduate Medical Education, and Peach Health Ontario. There are 3 phases to our project. The first phase is a pilot at Hamilton Health Sciences. The second phase is a transition into a national campaign, and in year 3, the project expands the national campaign across the country. Plastics are quite common in healthcare. They're found in everything from gloves to breathing circuits. And to maximize our impact, we focus on these 4 categories identified with our pilot site: perioperative care, textiles, packaging, and nutrition and cafeteria services. By definition, plastics are synthetic materials that can be molded into solid shape. Some common polymers found in healthcare are listed on this slide, and despite being polymers, only 9% of plastics are recycled in health. And in healthcare, it's estimated to be even less, around 5%, because of infection prevention and control considerations. And these statistics are from across North America and Europe. This year, our project manager and project advisors, Sandra and Linda, contributed to a Eunomia report that highlighted these 7 categories, which make up most single-use plastic consumption across healthcare systems in Canada and Europe. A key takeaway from this report is that engaging in circular practices over the next 15 years can reduce plastic use by 53% and progress the spirit of today, decarbonization, reducing greenhouse gas emissions by up to 55%. In fact, it's estimated that in 2023, healthcare single-use plastic items from across Europe and North America made the carbon dioxide equivalent emissions of 310 million emperor penguins. And big decarbonization is big savings. These plastics cost an overall $56 billion. Projections show that if we don't change course, these 3 will all rise by at least a third over the next 15 years. We had a great exercise by Deloitte today. As an extension of that reflection, are we headed in the right direction? I often turn to the literature as a compass to see whether I'm headed in the right direction in the work that I do on business cases and case studies. And it shows that we are headed the right way. A Peach-affiliated paper by Dr. Surgeon and colleagues depicts what hospitals can do to reduce greenhouse gas emissions. The fruits range from needle movers to change makers to game changers. We stand at the junction of theory and implementation, and it reminds me of when I asked my coach how to navigate having so many choices, and they told me, Tipu, turn off your camera and close your eyes. I won't ask you to do that, but instead I'll clear the slide. And imagine that we're at this peach tree, and there are 2 paths ahead. The first path continues to explore more research and landscape assessments. This is important because we need different species of trees, and we need to know more fruits that are on it. The second path is to take saplings from this tree and from hospitals across Canada and to plant them within our healthcare facilities. Our work supports both, and I brought 3 saplings with me today. These are plastic reduction initiatives with proven implementation that contributes to decarbonization and improves resilience against supply chain disruptions. Starting with Direct IV Push. This is an initiative from Alberta Health Services as part of a Green Team competition that they participated in. That Green Team competition was actually brought to AHS by Dr. Bhavini Goel, who is in the room with us today. The project team switched from using an IV tether setup to doing 15-second pushes for ketorolac within their emergency department. They had an annual 25% reduction in mini bag orders, along with better patient experiences and reduced operating costs. The next sapling is a reusable surgical mask. We created a business case in collaboration with Jerome from SSE and work done by Dr. Lindia Dernis at their hospital in Quebec. Some high-level numbers based on a Canadian procurement source when you amortize 1 reusable mask for 100 washes, and you compare it with 3 disposable masks, you save 48% in costs, decarbonized by nearly 98%, and when you factor in laundering, you still use less water throughout the entire procedure of using that reusable mask, then what is needed to create those 3 disposable masks? The final sapling is switching to using tap water in low-risk and non-sterile gastrointestinal endoscopy. Up until the 1980s, tap water was the standard, and in the 1980s, research sparked hesitancy, and we widely adopted sterile water. Following St. Paul's Hospital in Vancouver, the Ottawa Hospital, and St. Joe's in Hamilton, we collaborated with McMaster's PGME surgical resident, Dr. Megan Burke, over the last 10 months to pilot this at our site. And oh, do we have some results for you. 4,000 bottles, 700 kilograms of plastic sand, and we decarbonized by about 1,000 kilograms of carbon dioxide equivalents.
Wow.
With the coalition in hand, you can navigate proven green health implementation in any landscape. If you'd like to learn more about these initiatives or you'd like to be kept in the loop, please scan this QR code and fill in this form. It's a eco-friendly business. And with that, thank you very much.